Good morning, children. Today we are going to discuss about immunotherapy. Immunotherapy, immunotherapy of cancer. Immunotherapy of cancer. Number one, immunotherapy, also called biological therapy. Therapy means you know very well. Treatment, right? Biological therapy. Next, biological therapy uses substances substances okay substances uses substances made by made by the body made made by the body or in a laboratory in a laboratory laboratory made by a body or laboratory. Monoclonal antibodies. So what? Monoclonal antibodies. Okay, children. To improve to improve to improve or to resist the immune system to resist the immune system function. Resist the immune system function. Different approaches different approaches different approaches different approaches have been different approaches have been attempted attempted different approaches have been attempted in the in the in the immunotherapy cancer immunotherapy cancer immunotherapy immunotherapy. Next, immunotherapy immunotherapy appears to be important immunotherapy appears to be important in getting rid okay getting rid of the rid of the okay getting rid of the which one, very very important, getting rid of the residual malignant residual malignant residual malignant residual malignant cells after the malignant cells after the gross malignant after the gross tumor has been after the gross tumor has been removed. Gross tumor has been removed. The best results in the treatment okay of cancer is to follow an integrated approach approach, an integrated approach, okay, to therapy, to therapy. Okay, children, combining surgery, therapy, combining, okay, combining surgery, combining surgery. Next, radiotherapy, 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 chemotherapy, chemotherapy, and immunotherapy. Immunotherapy, chemotherapy, and immunotherapy are there. Okay, children, this is the most important concepts. Okay, so the next important lesson is, next important concept is the difference between normal cell and what you call cancerous cell. The differences between normal cell, okay, and what you called cancer cell. Normal cell and cancer cell. How normal cell will be there, how cancer cell will be present. The normal cell, small, okay, small, uniformly, small, uniformly shaped, uniformly shaped nuclei, uniformly shaped nuclei, relatively, relatively large, relatively large cytoplasmic volume, cytoplasmic, relatively large cytoplasmic, what you called volume. This is important. Next, large, large variable, large variable shaped nuclei, shaped nuclei, large variable shaped nuclei, relatively, relatively, okay, relatively small cytoplasmic value, cytoplasmic volume. Next one, conformity in size. Next, conformity, conformity, okay, conformity in cell size, in cell size, conformity in cell size and shape, and shape, okay, and shape, cells arranged into, cells arranged, okay, shape, cells arranged into discrete tissues, arranged into discrete, what you call discrete, discrete tissues, discrete tissues. Next, variation in cell size, variation in cell size and shape, variation in cell size, variation in cell size and shape, and shape, variation in cell size and shape, disorganized, 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 okay, disorganized arrangement of cells, arrangement of cells, arrangement of cells, arrangement of cells. Okay, children, that is important. Many possess differentiated cell structures. Many possess, many possess differentiated, differentiated, okay, differentiated cell structures, cell structures. Many possess differentiated cell structures. Normal, okay, normal structure, normal presentation of, normal presentation, okay, normal presentation of cell surface markers, of cell surface markers, That is important, children. Next one, it is loss of loss of normal, loss of normal, specialized futures, specialized futures, normal, specialized futures, normal, specialized futures, elevated, next, elevated, okay, elevated expression of expression, okay, elevated expression of certain cell markers, certain cell markers, certain cell markers. This is important. The next one, lower levels, the lower levels, okay, lower levels of dividing cells, lower levels of dividing cells, okay, lower leveling of dividing cells, cell tissues, cell tissues, cell tissues, clearly demarcated, okay, demarcated, okay, children, demarcated. Here large number of dividing cells, poorly defined, poorly defined tumor boundaries, poorly defined, poorly defined, okay, poorly defined, what you called tumor boundaries, tumor, okay, tumor boundaries, tumor boundaries, this is important, tumor boundaries, okay, poorly defined tumor boundaries, large number of dividing cells, okay, large number of dividing cells, there will be large number of dividing cells, poorly defined tumor boundaries are present. Okay, come on children, observe very carefully. We are discussing about immunotherapy of cancer. What kind of treatment is there for cancer right now? Nowadays, there will be the immunotherapy means immune our body only, our immune system only treatment will give the treatment for the cancer. So the immunotherapy is also called biological therapy. Why bio-life? In our body we are producing immunity against to the cancer. That's why it's immunotherapy is also biological therapy. Uses substances made by the body or a laboratory. Even in a laboratory also we can produce some treatment point of view, some substances. They are called monoclonal antibodies. Monoclonal antibodies we can produce in the laboratory. So these are useful to treat the cancer, to improve or to resist the immune system function, to improve, to develop the immunity or to resist the what you called the immune system function. We will be see different approach have been attempted in the immunotherapy cancer. Different approaches are there in the immunotherapy cancer. Immunotherapy appears to be important in getting rid of the residual malignant cells after the gross tumors have been removed. So immunotherapy appears to be important in getting rid of the residual malignant cells after the gross tumors has been removed. So malignant tumors, what they will be spread from one place to another place. So this very important. This immunotherapy appears to be important in getting rid to control the malignant tumors has been removed. The best results in the treatment of cancer is to follow an integrated approaches to therapy. So number one, combining surgery, radiotherapies, chemotherapies and immunotherapies. So combining surgeries, radiotherapies, chemotherapies, immunotherapies. So different therapies are there to control the which one, the cancer. Okay, treatment for combining surgery only we can remove the tumors. Radiotherapy, some rays we will send and we will burn the tumor cells or tumor causing what you called tissues. In chemotherapy, some chemicals we will use to control the tumors. Immunotherapy also, some monoclonal antibodies also we will give to control the tumors. Okay children, like that therapies are there. Combining surgery, radiotherapy, chemotherapy, immunotherapy are there to control the cancer. Normal cell, cancer cell, how to vary it? What are the differences between the normal cell and cancer cell? Normal cell, small and uniformly shaped nuclei. So very small and very uniform shaped nuclei, relatively large cytoplasmic volume. But in the large, what you call cancer cell, large variable shaped nuclei, Very large nuclei, small cytoplasmic value. Conformity in cell size and shapes. Cells organized into discrete tissues. So cell size and shape, conformed cell size and shape. There is no change in the cell size and shape, and the cells arranged into form the tissues. But variation in the cell size and shape, disorganized arrangement of cells. So there is no formation of the tissues and there is no formation of vertical organization. Many possess normal cells. Many possess differentiated cell structures, normally presentation of cell surface markers. So there will be cell surface markers are there, differentiated cell structures are there. Loss of normal specialized features. All normal cell features will be lost, and elevated expressions of certain cell markers. Elevated expressions are there on the cell markers. So lower levels of dividing cells, very less dividing cells. Here lower levels means here more dividing cells, right? What you called large number of dividing cells. Large number of dividing cells, lower level of dividing cells. In the normal cell, lower level of dividing cells. In the cancer cells, more level of dividing cells. Cell tissues clearly, okay, demarcated. Cell tissues clearly demarcated. Here poorly defined tumor boundaries. So tumor boundaries are purely defined. So easily it will be enlarged and it will be spread like that. Cancer cells are there like that. Normal cells, small uniform shaped nuclei, relatively large cytoplasmic volume. Large cancer cell, large variable shaped nuclei, relatively small cytoplasmic volume. Your nucleus is big, your nucleus is small. Conformity in cell size and shape, cell arrangement in the discrete tissues. So cell size and shape are conformed. There is no variations. But here variation in the cell size and shape of disorganized arrangement of cells. Many possess differentiated cell structures, normally presentation of cell surface markers. Loss of all normal specialized features. Normal specialized features, elevated expression of what you call certain cell markers also will be there. Lower levels of dividing cell tissues clearly what you called demarcated. Poorly defined tumor boundaries. Large number of dividing cells will be there in between the which one, the tumor cells and cancer cells. Okay children, like that there will be differences is there between the tumor cell and cancer cell. Now we are going to discuss about adolescent and drug and alcohol abuse. We are going to discuss about another concept. What is another concept? The new concept we are discussing. The new concept name is adolescent, and the new concept name we are going to discuss, that is the new concept name is what you called adolescent drug and alcohol abuse. Adolescents, okay, adolescents drug and alcohol abuse. Adolescents begin with a period of rapid physical and sexual development. Period of physical sexual development called puberty. To mature from 12 to 19 years of age. 19 years of age. Adolescence is very important. Adolescence is also a highly dynamic. Adolescence is highly dynamic period. Adolescence is highly dynamic of period of psychological psychological okay and social psychological and social changes in individuals. Next, adolescents are next adolescents are very important. See, adolescents are vulnerable to vulnerable to vulnerable to group vulnerable to group peer, okay, pressure, peer pressure, vulnerable to group peer pressure. Next, vulnerable to group pressure, and and many youngsters many youngsters are or pushed many youngsters are pushed into very important experimenting with drugs and alcohol. drugs and alcohol This is important. Proper education proper education Number one, proper education and and guidance okay, guidance would enable would enable enable youth to say youth to say no to drugs no to drugs and and alcohol no to drugs and alcohol, and to flow and to follow a healthy lifestyle. Okay, this is important, children. Next, first one, alcohol. We will discuss about alcohol. Alcohol is a psychoactive drug. Alcohol is a psychoactive drug which acts on the brain which acts on the brain affecting 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 a person's mind affecting a person's mind and behavior okay, children, this is important. And behavior, it is a depressant it is a depressant which slows down is a depressant which slows down the activity of nervous system. This is important, children. The intake of certain drugs for a purpose certain drugs for a purpose other than their normal clinical normal clinical use, normal clinical use in an amount, in an amount and frequency, and in frequency that impairs, that impairs, okay, that impairs one's physical, that impair one's physical, okay, physical, physiological and psychological, psychological functions, functions, psychological functions is called, very important word, drug abuse. It's called drug, what do you call, abuse, drug abuse. Okay, children, observe very carefully. We are going to discuss about adolescence and drug alcohol abuse. Nowadays, the youth are struggling, are suffering with these habits. So they are not able to come out from these bad habits. So that one we are going to discuss. Adolescence begin with a period rapid physical and sexual development called puberty. After certain age, there will be, you know very well, puberty will be start. That is called, very important, sexual development will be called puberty. To mature from 12 to 19 years, 12 to 19 years of age. Adolescence is also a highly dynamic period of psychological, social changes in individuals. Adolescents are vulnerable to group pressure. So peer pressure is common. So what the friend will tell, that one we are ready to do, like that they will feel. And many youngsters are pushed into experimenting with drugs and alcohol. Many youngsters are pushed into experimenting with drug and alcohol. So proper education and guidance would enable youth to say no to drugs. Proper education and guidance required to no to drugs and alcohol to follow a healthy lifestyle. Okay, children, adolescence begin with a period of rapid physical sexual development called puberty. Physical puberty to mature from 12 to 19 years of age. Adolescence is also a highly dynamic period of psychological and social changes in individuals. Adolescents are vulnerable to group pressure. So friends will be, mainly the friends will call the other friend. Good friend is there in the sense very good habits he will have. Bad friends in the sense he will be, what will happen, he will get bad habits. And many youngsters are pushed into experimenting with drugs and alcohol. Proper education and guidance would enable youth to say no to drugs and alcohol and to follow a healthy lifestyle. Alcohol is a psychoactive drug which acts on the brain. Alcohol is a psychoactive drug which acts on the brain, affecting a person's mind and behavior. It is a depressant which slows down the activity of nervous system. So alcohol, where it will be, it's a depressant, slows down the activity of nervous system. The intake of certain drugs for a purpose other than normal clinical use. So we will use in the clinical point of view. Other than clinical use, if you take purposefully amount and frequency that impair one's physical, physiological, psychological functions called drug abuse. So if you take therapy, what you call the therapy point of view, no problem. But if certainly wantedly you take such kind of drugs in the sense that will be affect the physiological, psychological functions called drug abuse. Okay, children. So next class we will discuss about the cocaine. So we will discuss about the cocaine and cannabinoids. Okay, opiates, such kind of drugs in the next class. Thank you, children.